Dr. Elaine Halley. I work in Scotland in the UK. I've got one practice that's my own practice, but I'm also a clinical director for a group of 6 practices, so I split my time between seeing patients but also mentoring young dentists as well. Often as dentists we get very focused on the clinical, we see what the problem is and we know how to treat it, but we forget that we need to bring the patient along with us on that journey. I believe that the key role of general dentists is to almost be the captain of the ship. I believe it's a responsibility of the general dentist to diagnose and to see everything that's going on in a patient's mouth and what the consequences of treatment might be, and also what the consequences of non-treatment or non-intervention might be. So I think in terms of the education that I do, I spend a lot of time talking about the psychology of patients, talking about the importance of verbal skills and how the actual language that we use can help motivate a patient towards certain treatments or away from certain treatments. So I think that's a key part of the need today. It's important that malocclusion is addressed for a number of reasons. I think when teeth aren't aligned correctly over time, the surfaces that are functioning or grinding against each other can wear in ways that are then detrimental to the overall stability of the mouth. So that's one reason, is to make sure that teeth wear appropriately, and that if, for instance, a tooth that's not designed to wear against itself deteriorates, then other teeth start to contact that are not supposed to contact in certain movements, and the whole spiral of instability goes on. I also think, though, if teeth overlap, it can be more difficult for patients to clean in between their teeth, and that can then lead to a higher risk of tooth decay and also gum disease, periodontal issues as well. I think the key motivators for patients are different. I think the important thing is to understand and know who your patient is, because for some patients, absolutely aesthetics will be the key motivator and driver. But for other patients, aesthetics is absolutely not the key motivator and driver. The general dentist doesn't need to be able to treat all of the situations, whether it's moving teeth or other aspects, but they should be able to identify them and be able to advise the patient and refer to specialists or colleagues where appropriate, but sort of maintain that overall health of the patient. Digital is really a game changer. It's revolutionising the whole patient experience and how we can engage the patient, but also how we can be better at diagnosing and better at treatment planning. So firstly, the ability to be able to capture the patient. So to be able to use scans, digital radiography, digital photography and video means we can create a virtual patient, but also be able to then present visually back to the patient. For instance, a digital tour of their mouth, you can move the image, you can let people see behind their teeth from all different aspects, is hugely motivational, because I think, words don't do it in dentistry. You have to be able to show and be able to demonstrate, and patients need to feel ownership of that is my mouth, and therefore I understand the issues that are going on. I think responsible dentistry means you need to share everything that you see. You need to also then go and find solutions, even if it's not yourself that's going to be carrying out the treatment, so that you're sharing everything ethically with the patient. What isn't responsible is to not tell them because either you don't think they want to hear, or because you don't entirely know what your recommendations would be. So as a professional, what a healthy smile means to me, I kind of split in two. I feel initially there's the psychology of a healthy smile, and then obviously there's the dental aspects of a healthy smile, meaning biological health, healthy structure of the teeth, and teeth that are functioning against each other healthily without any signs of instability. Being able to smile and express yourself with freedom without being constricted because you're self-conscious about your teeth is part of being a healthy individual. So moving teeth fits into the overall comprehensive dentistry approach.